Make no mistake, the coronavirus pandemic is still very much here, even as we restart parts of the economy and our society. So let's bring in the public health director from Cayuga County tonight, Kathleen Cuddy. Kathleen, thank you so much for joining us. It's great to have a chance to talk to you.
My pleasure. Thank you for having me on.
So we really haven't talked to you in quite some time, mostly because the numbers have been relatively low. So give us an update on how the situation looks in terms of COVID-19 in Cayuga County now, about not quite 3 months into the pandemic here.
Sure. So as of this afternoon, we have 101 positive cases since we've started testing residents of Cayuga County. We certainly have seen the greatest increase within the last few weeks here in Cayuga County, and seen more hospitalizations of people within our county as well.
So the obvious question then is, why are you starting to see this uptake in cases during May and even early June when it looked like you guys had really flattened out the curve? Some days you were seeing no new cases at all. I can remember looking at the data. What's going on?
You're correct. What we think is probably happening is a few things. One, the weather's gotten nicer. So we found one uptick in a situation that occurred the beginning of May was due to a lack of social distancing at a social gathering. And this was prior to the 10 people or less gathering guidance that has been offered. We're also seeing more mandatory testing and pre-admission testing for hospitalizations and at employees of nursing facilities and adult homes. And we've caught a few in that case as well, but primarily it's been essential workers.
We continue obviously now into phase 2 in Cayuga County, like Onondaga County and surrounding counties here. Keep cracking that valve open a little bit more here. And now even today, even more with this idea of allowing outdoor eating and serving at restaurants here. How do you think that influences keeping a cap on COVID-19? What do you say to people who do desperately want to get out to do something, but also support local businesses as well? How you walk that line of getting out, but doing this kind of thing safe?
I think following the guidance that we recommend, we certainly all need to move forward and find a way to safely do so. So maintaining our social distancing where we can, wearing our face covering, washing our hands, all these health guidance that has been provided routinely, we need to keep doing it. It's a behavior change within us, but we are capable and we're doing it. We can do this.
How much falls on employers too? I mean, we put a lot obviously on ourselves to go to these establishments, to go out, even being at work ourselves, wearing face masks, washing hands, things like that. How much falls on the employers to create an environment that is safe and healthy for their workers?
Well, employers are being asked to put together safety plans. The New York Forward site provides some templates for that. And a lot of it is a common sense approach, encouraging employees not to come to work when they're sick, keeping distance between workers where you can, washing hands, providing face coverings if need be. It's a very manageable, it's a very attainable goals.
One last question for you I can get in here. A lot of talk about testing. Obviously, there's a minimum amount of testing that has to go on to keep moving through these phases here. We clear that by double, even sometimes triple that. But you have some testing going on. I think it's on Friday this week. Tell us a little bit more about who that's available to, what it is, where it is, and how that works.
Correct. Thank you. So we do ask people to make their appointment online at www.cayugacounty.us/health. And we've been doing drive-through clinics, typically twice a week here in Cayuga County. And when you make your appointment, it will tell you the site that you can go. It's been very successful, very efficient. We've got a great team of people working here at the Cayuga County Health Department.
Oh, open to anybody?
It's open to essential workers. It's open to phase 1 and phase 2 workers, people who are symptomatic, and their household members.
That's enough, I think. That's a lot of people that can get tested. Kathleen, I can't thank you enough for joining us tonight. Really appreciate it.
Thank you.